Hi everyone, I hope all is well. For my research paper, it was on veterinary nuclear medicine studies. My paper was titled Veterinary Nuclear Medicine, an Underused Modality. In regards to why I chose this particular topic, I'm sure it's not a surprise to any of you guys, but I am a veterinary technician currently. I've been in the veterinary field for about 5 years, and I was actually introduced to the nuclear medicine modality through my job. We sent a hyperthyroid cat for an I-131 thyroid ablation. So that's what introduced me to this modality. In regards to how I found relevant content for this research paper, I definitely used the databases at my disposal. I was having some difficulty finding relevant information, and I'll talk about that more in the challenges section of my presentation. But in order to help with that, I used the Ask a Librarian feature a lot during the course of this paper. I'm sure they're all sick of me over there, but they were very helpful, and they definitely helped me find information that was relevant to my paper and information that I thought wasn't relevant. By reading between the lines and diving into that certain databases and certain peer review articles, it can correlate to my paper, if that makes sense. But I want to talk about this research paper a little bit. So I did conduct a small survey out of 11 general practice veterinarians, and I asked them a couple of questions regarding the nuclear medicine modality, their general views on it, and if they had any particular challenges with it. Based on their responses to the survey, I did integrative review of literature and able to expand on their answers to the survey and draw conclusions. So the survey I sent out had the following questions. Question 1, how long have you been a veterinarian? Question 2, where did you go to veterinary school? Question 3, are you familiar at all with with nuclear medicine diagnostic imaging and therapies? Question 4, in veterinary school, did your professors ever talk about nuclear medicine scans or therapies? Question 5, have you ever referred a patient for a nuclear medicine scan or therapy? Question 6, if answered yes to question 5, what type of nuclear medicine scan and or therapy was suggested? And then the last question, have you utilized the nuclear medicine modality a lot in your career? Why or why not? And I based the majority of my paper on those 7 questions and the veterinarian's responses to those questions. So I just wanted to summarize kind of some of the answers that the veterinarians gave. Like I said, 11 general practice veterinarians were asked, no specialties. So the experience of the veterinarians ranged from 1.5 years to 28 years, with the average years practice is 8.5 years. 8.5 years is the average years practice. As far as the schools go, we had 3 veterinarians that went to Colorado State University, 2 that went to Midwestern University, 1 from Ohio State, 2 from Ross University, 1 from St. George's University, 1 from Washington State University, and 1 from Madison, Wisconsin University. For question 3, all of the veterinarians surveyed stated that they were at least a little familiar with nuclear medicine studies and in regards to imaging and therapies. For question 4, all of the veterinarian surveys were taught. Oh, I just said that, didn't I? In question 4, all of the veterinarian surveys were taught a little bit about nuclear medicine in school. though they all stated that the material covered was very minimal. Question 5. 7 out of the 11 veterinarians have referred patients, be it one or plural, for a nuclear medicine scan or therapy. So 7 out of 11, that's pretty good. That was more than what I was expecting. Question 6. 6 of the veterinarians have sent multiple patients for thyroid ablations. 3 have referred multiple patients for a thyroid uptake and scan. 1 has referred a patient for a bone scan. 1 has referred a patient for a gallium tumor imaging study. And 1 has referred a patient for a transcolonic portal scintigraphy study. And I'll talk about question 7 a little bit later. So the survey results showed that the longer the veterinarian has been practicing, the higher the likelihood that they have referred a nuclear medicine, they have referred a patient for a nuclear medicine type of procedure. Only 1 veterinarian who has been practicing less than 5 years has sent a patient for a nuclear medicine scan or therapy. The results of the survey also show that the majority of the nuclear medicine scans ordered were for thyroid-related issues, more specifically for thyroid ablations. Sorry about the door in the background, everyone. The second most ordered procedure is for a thyroid scan. And based on my research, thyroid-related studies was one of the first nuclear medicine procedures performed in veterinary medicine, and it is now the most frequently performed veterinary nuclear medicine procedure today. In regards to question 7 of my survey, and to just remind you, question 7 was, have you utilized nuclear medicine as a modality a lot in your career? Why or why not? The responses were surprisingly similar. No. And there are multiple reasons for that. The main reason that they gave was affordability to pay for veterinary services. When it comes to diagnostic imaging versus treatment, and I do have personal experience with this, if there's something wrong with the pet, a lot of the times the owner will elect to pay for the medications to treat the symptoms versus pay for the diagnostics needed to find the root cause of the issue. So diagnostic veterinary scans are a diagnostic procedure, and pet owners would rather pay for a medication to treat the hyperthyroid cat versus doing a thyroid uptake and scan, for example. The second reason is comfortability. Ooh, say that 5 times fast. Comfortability with the nuclear medicine modality as a whole. Out of all of the veterinarians surveyed, only 1 veterinarian stated that their school offered advanced elective courses in nuclear medicine, though that particular veterinarian did not pursue that route. Another veterinarian stated that they only feel comfortable sending in a patient for a thyroid-related issue because that's the only one that they're familiar with. They don't know enough to educate the pet owner about the other scans and therapies performed. Another reason why not a lot of veterinarians used the nuclear medicine scan or nuclear medicine modality as a modality was due to owner compliance. And then a lot of facilities, there's not a lot of facilities in Arizona that even offer nuclear medicine. One of the veterinarians stated that if they do refer a patient for a nuclear medicine scan, they have to drive out to Midwestern University, which is the vet school in Glendale, and depending on the patient's or the owner's travel arrangements and living situations, traveling across town may not even be an option for them. I do know there a couple of the emergency departments that have internal medicine specialists do offer nuclear medicine therapies, but not scans, not imaging. And one of the main reasons, and not specifically asked or answered in the survey, but what I found through more research, is radiation safety regarding radiated pets post RP administration. And this is what I found very interesting. Unlike people, veterinary patients are handled the same way radioactive materials are, which means there are tighter controls on handling the animal after radiopharmaceutical administration. Any animal that has received a radionuclide must be held in some type of isolation until their radioactivity has decreased to an allowable limit, which is background radiation, more or less. They have to be held in a cage or a stall, and unlike most people, having to deal with all the urine and feces related to that is a huge radiation safety issue. And a significant contamination issue. The patient is only allowed to leave the facility once they reach a meter reading of 0.2 to 0.5 mR per hour, but a lot of the times they require a 24-hour hold on the animal no matter what nuclear medicine dose was given. So that increases the price for the veterinary hospital as well as the owner. And lastly, any cage or stall that held a radioactive animal has to be held vacant for 60 hours, and that could be even more depending on the radiopharmaceutical that was given. Lastly, and the last reason why the veterinarians don't utilize nuclear medicine a whole lot is if they're doing a scan, the animal will have to be put under general anesthesia. So that, again, increases the cost for the owner, which is also a giant issue, and it could be a safety issue. There's always risks associated whenever you put anything under anesthesia. I did want to talk about my limitations to this research. The survey was only sent out to 11 veterinarians in the Phoenix metropolitan area, and they were only general practice veterinarians. No specialists were asked. So if I was able to broaden the specialties of the veterinarians as well as the geographic scope, my results of this research project might have been very different. So those are the reasons why the veterinary the nuclear medicine modality isn't as used in the veterinary world. Lastly, I wanted to talk real quick about the challenges I faced. Like I kind of mentioned at the very beginning, finding relevant information in a peer review article basis was very difficult. Most of the information I found were protocols on how to do a bone scan on a dog, or protocols how to do a thyroid uptake scan on a cat, which is interesting, but not necessarily related to why the nuclear medicine modality is underused in the veterinary world. I had to kind of broaden my research, keywords entered into the search bar type of deal. So I found most of my time was just looking for information that I could cite, which I guess is for any research project, but I felt like I had to utilize the Ask a Librarian feature a lot more than I really wanted to, if that makes sense. I definitely needed help to find information related to this. This was my biggest challenge. But anyway, that was my research project. If you have any questions, please comment below. I'd love to answer them. Thanks.